Welcome to the pilot episode of Strategic Healthcare Marketing Roundup. I'm Jane Weber-Brubaker, Executive Editor of Plain English Healthcare. Each month, we'll bring you the latest trends, tips, and takeaways in healthcare marketing and strategy, and share insights from leading industry voices. So let's take a look at our latest stories right now. UNC Health's research-based comprehensive plan to address vaccine hesitancy, a mentorship program for high-achieving African-American students that seeks to develop future healthcare leaders. Boston Children's creative solutions to keeping the donations flowing even after the Boston Marathon was canceled. How a regional hospital system's radio campaign increased its telehealth and urgent care traffic without breaking the bank on media and production costs. And finally, a conversation with Toby Cosgrove, former president and CEO of Cleveland Clinic, about how technology accelerated innovation during the pandemic and what that means for care delivery in the future. For our first story, Susan Dubuque, principal and NDP and a member of our editorial advisory board, interviewed Victor Rice, Vice President of Consumerism and Insights, Marketing and Communications at UNC Health. Rice shared the details of UNC Health's vaccine communication strategy, which focuses on persuading the vaccine hesitant. To better understand the reasons for their reluctance, UNC conducted extensive research, and based on what they learned, they crafted a strong message. Rice says, "We believe that consumers who are educated and armed with facts are empowered to take action." UNC Health's next challenge was managing consumer expectations in the early days of vaccine distribution when the supply didn't meet the demand. Let's hear what Rice had to say about that.
We want to get shots in the arm, but right now, which is a positive, the demand is there. But we also want to make sure we don't discourage. And so the one things I've told people, we have to look like it as a retail model. What we don't want is those who are ready and willing to get the vaccine. We don't want the experience or the challenges of getting a vaccine to soon become like if you're in your favorite department store, the line is long, and you say, you know what, I'll come back later. And how many of us ever go back to get it? And so that's something we keep, front and center.
UNC Health communicators mapped out the message and the messengers. Check out the article and the webinar to see how they worked with influencers, including an NFL star, to spread the word. Our next story features an interview with John Bluford, founder and president of the Bluford Healthcare Leadership Institute. Bluford is the former CEO of Hennepin County Medical Center and Truman Medical Centers. His goal in founding the institute was to develop scholars from among minorities who could one day envision themselves walking into the boardroom and taking command. Most programming takes place in a boardroom. Why? Because the boardroom isn't a big, scary place for them. They've been there before, Bluford says. Scholars are recruited from historically Black colleges and universities. Through the program, they have access to nationally recognized leaders from top health systems and even cabinet secretaries. Read the article to find out how your organization can tap into top-notch talent from this prestigious program. Next, we have a story about resilience in the face of massive changes to traditional fundraising brought on by the pandemic. Every year, almost 200 people run in the Boston Marathon to support Boston Children's Hospital. So how do you make up for those losses when the event gets canceled, not once, but twice? Boston Children's Hospital Trust came up with creative solutions that still raised millions. If you're looking for some fresh ideas to keep your donations coming in, check out this story. Radio is part of life's background sound, says Peter Hochstein, the writer of our next story. Cox Health made radio the centerpiece of a multi-channel ad campaign that talked mainly about telehealth and reservations for urgent care. To reach the widest possible audience, the campaign focused on top program buys in streaming radio. Peter writes, "The radio spots always involve two people, somebody talking about a healthcare problem that needed prompt attention, and a character with a preposterous voice who kept interrupting, sometimes with absurd comments." Here's one example.
So the other morning, my little girl woke up crying.
Hello, nightmare.
No, actually, it was an earache.
Hello, throbbing, stabbing, unrelenting agony.
Yeah, that's pretty much what it feels like. And it was getting worse, so I figured I'd better get her to a doctor.
Hello, emergency room.
No, not the ER. Heavens no.
Hello, waiting room.
You know what? Not this time.
Hello.
Save my spot.
From Cox Health.
Yep, you got it.
Take a look at the article to see the great results this campaign drove and get some tips for how to make the best use of this relatively affordable channel. Our last article features a conversation with Toby Cosgrove. Dr. Cosgrove stepped down from his position as CEO and president of Cleveland Clinic in 2017, but he's anything but retired. He serves on the board of numerous health technology companies that paint a picture of what's trending in healthcare. Telehealth is one example of how the pandemic has accelerated some of these trends. It was starting, but this has been a tsunami of telehealth, Cosgrove says. He stresses the importance for technology innovators to work within the healthcare system and focus on large teaching hospitals that have the stature to influence the rest of the industry. Check out the article to find out what one of the industry's great innovators sees when he looks in his crystal ball. That's it for this month. If you're a member of Strategic Healthcare Marketing, you can view the full articles right now at strategichcmarketing.com. And if you're not a member, this would be a great day to change that. You can sign up for a free 7-day trial, view these articles and many more. Again, I'm Jane Weber-Brubaker, Executive Editor of Plain English Healthcare. We hope you enjoyed this pilot episode of Strategic Healthcare Marketing Roundup, and we hope to see you again next month. We'd like to dedicate this episode to our longtime columnist, Peter Hochstein, who passed away unexpectedly in April. From an editor's perspective, Peter was a joy to work with. I never had to assign a story to Peter. He always came with pitches of his own, scouring the internet for interesting campaigns to dissect for his monthly column. We will miss his wit and humor and his gift for storytelling. If you'd like to sample his hilarious and insightful stories, look for his column, Notable Healthcare Advertising, under departments on our website, strategichcmarketing.com.